Growing up on the shores of Lake Michigan in Muskegon, little Diane Downing, that's her on the left, was exposed to medical missionary work at an early age. The daughter of a mechanical engineering father who designed car engines and a piano-teaching mother, Diane's parents regularly hosted and provided financial support to missionary friends who would share fascinating stories of life around the world, especially in Africa and South America. Their tune resonated with Diane. By the time she was in 6th or 7th grade, Diane knew she wanted to be a nurse, and she had her heart set on going to that part of the world where the need was greatest. And so she set sail, beginning a journey that culminates with her inclusion into the Medical Mission Hall of Fame as a member of the class of 2010. Diane's formal nursing education began at the West Suburban Hospital School of Nursing in Oak Park, Illinois, where she earned a diploma in nursing in 1963. Her mom and dad were on hand 1 year later when she completed her bachelor's in nursing at Wheaton College. Diane's inaugural trip abroad came after she accepted her first missionary assignment. Having been assigned to Congo, Diane immersed herself in a 10-month study of the French language in Switzerland. It was there that her parents visited Diane and their 2 young granddaughters, Dawn and Shelley. The road to Congo was anything but smooth. Next came a diploma class for nurses at Prince Leopold Institute of Tropical Medicine. It was mandatory training for nurses heading to locations in the Congo that had no resident physicians. In 1971, Diane arrived in the Congo. Her first stop was Oicha in the Ituri forest, where she joined a hospital staff that served 1,200 outpatients per day. When Diane drove to the villages, she served small clinics in the pygmy population. Daughter Dawn is carrying a pygmy orphan the family brought to Diane for medical care after the mother's death. But while there is death, there is life. Diane's son Scott was born in Congo. Scott is now living in Chad, following in Mom's footsteps. He's a missionary school builder. Diane's daughters, Dawn and Shelley, have also followed Mom's lead. They're both nurses and perform missionary work. In 1980, Diane began working in Asa. When she arrived there was no medical care. She was greeted with the news that 500 children had recently died in the area from a measles epidemic. One of her first projects was immunizing villagers. In the next 10 years, there was but 1 death from measles. As the primary care provider in Asa, Diane spent much of her time examining, diagnosing, and treating patients while conducting well child clinics and training clinical assistants. In the Congo, with no physicians available, Diane delivered 400 babies. The mortality rate also improved as she instituted prenatal clinics for the villagers. In Asa, Diane was the sole medical professional within a 100-mile radius. The nearest town was 350 miles away and travel time was at least 3 days. To ease the load, Diane trained villagers to become midwives. They assisted with medical care, taught classes, and aided the business operation. Throughout her career, Diane saw it all. This villager had been gored by an elephant but survived because a visiting surgeon happened to be in Asa at the time and another surgeon had left a supply of antibiotics. At the forefront of health promotion and disease prevention, Diane is renowned for her expertise in the treatment of endemic goiters and cretinism. She has authored and co-authored publications on the topics, performing studies while working with traveling missionary physicians like Hall of Famer Glenn Gielhud. This is what made it all worthwhile. The mother had her goiter removed, the husband had his hernia repaired, and the family was treated with iodine. Now living in Gaithersburg, Maryland, where she serves as an instructor for certified nursing assistants at Montgomery College, Diane looks back on her 20-year missionary career with fond memories. This was one of her first thyroidectomy patients who needed a tracheostomy to survive. She became one of Diane's good friends. A friend and lifesaver to thousands in the Congo, Diane Downing, the newest inductee into the Medical Mission Hall of Fame.